All right, excellent. Before we begin, I'd like to thank Amanda for this amazing opportunity. My name is Mohammed. I'm a co-vice president of Club Med Virtual, and I'll be leading our session today. Before we start, I want to remind everyone to maintain proper etiquette and keep yourselves on mute unless Amanda specifies otherwise. If you guys have any questions, please post them in the chat and we'll address them as we proceed during the Q&A portions of the session. We'll be posting a Google survey in the chat at the end of the session that will remain open for 30 minutes. We ask that you guys please stay on call at least 5 minutes after the session is over to ensure that the survey is working for you. The session will also be posted on YouTube in case you guys are unable to attend or want to revisit certain topics, but you will only receive attendance hours if you are present in the call and complete the survey. With that, I'll pass it over to Amanda if you'd like to introduce yourself.
Yeah, thank you for the introduction. Hey guys, so my name's Amanda. I'm a third-year medical student at Wayne State. A little bit about myself. I grew up in Michigan. I went to Wayne State for undergrad, got my BS in biology. So now here I am. Right now, I'm not really in that many clubs. I was interested a little bit in genetics. I'm currently doing this AHEC Scholars Program, which focuses on public health in Michigan, specifically in rural and urban communities. And something I'm probably interested regarding like a specialty. I do like family medicine. I also like OB-GYN, but I haven't finished all of my rotations, so we'll see if that changes. Okay, do you want me to just wait for questions or just?
Yeah, we can actually add a couple, we have a couple questions here.
Okay.
How does the community at the Wayne State University School of Medicine compare to the community that you were a part of as an undergraduate?
Okay, so I mean, since I went to Wayne State for undergrad, it's kind of a similar community. The med school, just like undergrad, focuses on the Detroit residents. They focus on low income families. We do a lot of volunteering within Detroit, just because there's a lot of healthcare disparities here. A lot of people do struggle. Like for an undergrad, when I was doing the honors program, they did a lot of community service here in Detroit. It was a lot of community gardening, there was cleaning, there was working with schools, educating schools, and we kind of do something similar here in the medical school, but we're more focused on medicine. And we have a lot of our clinics here in Midtown, as well as a little bit outside near the suburbs. Okay, so Valerie asked, what's the difference in curriculum between OU and Wayne Med? So I'm not very familiar with OU, but my sister does go to Oakland University for medical school. From what I learned, they kind of have a similar curriculum as us. They switched to an organ-based system, which is kind of the new curriculum that a lot of medical schools have adopted. Instead of being subject-based, like pharmacology, then embryology, then histology. Now it's based on systems or organs, where we go with cardio, palm, GI, renal, and OU is doing the same thing. I know we take NBME exams for our regular exams for each unit, and that's what OU is doing as well, but they might have a few more professor written exams as well. But they are very similar from what I see with what my sister is doing at Oakland.
All right, there was a question asked, who was your genetics professor at Wayne State?
My genetics professor, I can't remember his name. It was a very short name. He was Chinese. I remember him talking about coming from China, but I can't remember his name. It started with a C, maybe Dr. Chua.
Does Chuanzu Fan sound familiar? Because that's actually who I'm taking right now for genetics.
He does sound familiar. I think that is him. Oh, yeah, I had him for another course, actually. He is a good professor.
Cool. What is one thing that you did as a pre-med that really helped you in med school?
Okay, so in pre-med, I did I did, one thing I really liked was research. Even though we don't do a lot of research here in medical school, the hands-on experience definitely helped me with the hands-on experience regarding the labs that we have to do. Like for microbiology and for immunology, you are going to have to do some hands-on labs. Like we had to do blood draws, we had to do bacteria cultures, and I feel like research helped me with that as well. Some other stuff is the volunteering because you have to balance a lot in medical school. You don't want to overdo it. You don't want to stress yourself out. So you need to learn how to balance extracurriculars, volunteering, and your schoolwork during undergrad so that you're prepared for medical school. So I tried to keep how much I did for volunteering at a minimum, maybe two, maybe three different organizations at the most.
Which classes helped you transition to med school?
Which classes?
Yeah.
That's a little tough because such as A and P. Okay, so I didn't take A and P, but I did take biochem. And I kind of used undergrad as an opportunity to take classes that I wasn't going to be able to take in medical school. Like I took ecology just because I love ecology. But what a lot of medical students do is they do take A&P. Some of them take proteomics, which is the study of proteins. Um, uh, I know there's a physiology course a lot of students take as well. Those definitely help for medical school. They are on the tougher side, but they resemble the courses you take in medical school as well. So I would suggest those types of courses. Let's see. Biochem, actually, I would suggest biochem as well. I know it's an elective. You are going to learn a lot of biochem during your first year. So that's a really good course to take as well.
Cool. Someone was curious in chat to learn more about what you did for research.
So what I did for research was develop evolutionary, it was mostly evolution and developmental genetics. I worked with Dr. Popovich. So I kind of worked with bugs. I was given a project where I was studying a gene. I had to kind of silence that gene and see what would happen in the species. And I kind of wrote a paper on there. So there was some genetics in there as well. The type of genetics you learn in medical school is not really the same. It's more like the type of genetics you took as a course, not as research. Like, you have to learn inheritance patterns, probabilities, a lot of those Punnett squares. That's the type of genetics you will see a lot in medical school, but it's definitely not as difficult as it was in undergrad. It's pretty basic.
Great, thank you. With regards to applying to medical schools, what was the most challenging aspect of the interview process?
So when I applied to medical school, some schools they had 3 parts, some schools just had 1. For Wayne State, there were 3 parts. There was the MMIs, the student interview, and then the actual interview. Personally, I felt that the interview with the physician was the hardest for me because they actually tell you don't need to talk during this interview. We just want you to listen. And like sometimes they would ask questions and I would want to say a lot, but they would just be like, no, don't worry, just listen to what we have to say about the school, kind of you kind of interviewing us. So I feel like that's the hardest. You just have to be honest. You have to show them who you really are and just be normal and don't stress about it. Because if you stress about it, you're not gonna do very well. The MMIs are pretty easy scenarios to think about. It's just what would you do in this situation? And you just have to be honest. You have to be empathetic, which is very, very important in medical school. And that's what they usually look for. And then the student interview, that's very easy. It's laid back. The student just tries to get to know you and see if you're a good fit, if you're someone they would want to work with.
Okay, and what helped you prepare for those interviews?
So lots of practice. I bought this one book off Amazon. It said why medicine. Um, and it just has a bunch of different questions that you can practice on. It gives you different scenarios. You can also talk to people who have interviewed before just to get some tips. I know you're not allowed to, give out what the MMIs are, what the questions are, but it's just practice and being comfortable so that you're not nervous on the day of your interview. Everybody's nervous, but with practice you'll do well. Just know what you're going to say beforehand with the questions you look up. And from that book was very, very helpful with all the different questions that it had.
Okay. How did you get involved in research as an undergrad?
So for research, I had to email a lot of professors. I just looked up, if you go on Wayne State's website and you can look up research in each department, I looked up the biology department because I was studying in biology and I like biology. So I just looked up the different professors, what their research is in, and I emailed as many professors as I could and just saw whoever responded back to me. You can also look up Wayne State School of Medicine and see the research they're doing because they do like to take some undergrad students as well to do research. As long as you're involved in some kind of type of research, it looks good. And make sure it's something you're going to enjoy because it's, the longer you do it, the better. The more committed you are, the better.
Do you recommend taking a gap year during undergrad?
So a gap year is not a bad thing. I applied right after I graduated. I got some interviews. I was waitlisted, but I didn't get in. So I had a gap year. And I had to kind of build up my CV, my whole application during my gap year. And I'm like very thankful for it. It was a nice break. It helped me kind of improve and see where I was lacking. I talked to different advisors during that time. I was able to even go on vacation at some point. So a gap year is definitely not a bad thing. I would suggest it if you think you can um, really do something productive, or even if you just need a break, that's totally okay. A lot of people take a gap year just to take a break, figure things out, get their application together, and it's totally normal. A lot of people take gap years. A lot of people in my class have taken a gap year.
Where did you get your patient care experience?
So that's what I did during my gap year. I did a few things. I was a scribe for about 10 months. I I joined Global Brigades and we went to Ghana on a medical mission trip. That doesn't mean you have to do that. Not a lot of people do that. It's not something everyone can afford. I just got lucky. So there's a lot of ways to get patient care. You can be a scribe, you can be an MA, you can work in EMS. Volunteering is also a good way to get patient care. What else? I think that's all I can think of right now. But as long there's a very diverse amount of patient care out there. But I did a lot of scribing.
How stressful is med school compared to undergrad?
So no matter what I tell you guys about med school, you won't understand until you're in it. It really is like I'm not trying to scare you guys. You will get used to it, but once you start med school, it kind of hits you. It really is like that fire hose that hits you, but you definitely get used to it pretty quickly. The first month or two was difficult for everyone. The school understood. They kind of helped us out, but you get used to it very quickly. It's I don't even know how to describe how stressful it can be compared to undergrad. Um, I really don't know how to tell you guys that it is stressful. It's a full-time job.
How did you study for the MCAT?
So what I did, I so I did not do very well my first time. I tried studying on my own. I did maybe 2 or 3 practice exams. So during my gap year, I retook the MCAT. What I did was I took a Princeton course, um, And then I tried to get through all the books. I did a lot of practice exams. I think I did 8 practice exams, and that significantly improved my score. So I don't think Princeton, no, they still have courses. So you can have Princeton or you can have Kaplan if you decide to do the course. There's an online course. I think that's all they're doing now because of COVID. You don't have to take the course. You can just buy the books and buy the practice exams if that works for you. It just depends what works, for each person, it's different. I found that the Princeton exam helped me. My sister took Kaplan, and that helped her for the MCAT. So it just kind of depends on what you like and what helps with studying.
Being a medical student, how did COVID-19 impact your path this year?
So this year, because I'm in the first class that starts this new curriculum, we were supposed to start our 3rd-year of rotations April 1st. And because of COVID, we didn't start until July 6th. So that cut down a lot of time during rotations. So instead of having a 12-week surgery rotation, we got 6 weeks. Same thing for internal medicine. That was supposed to be a 12-week rotation. That also became 6 weeks. So we had to cut down a lot. We lost some of our vacation time. And we really had to pick up the pace, work really hard, work more each day, just because so much time was cut out, and that we have to be extra careful with COVID. I know when I go to the hospital and we see a COVID patient, they don't really let medical students see those patients because you got to wear PPE, you have to go through this whole process, and it's safer to not have medical students see COVID patients. But we are still able to see, as many patients as possible. They get screened before before anybody sees them really. And honestly, wearing the mask all the time, you get used to it. It's just become part of your uniform. You don't even notice you're wearing it.
Where do you recommend searching for community service hours?
Okay, so I know Wayne State has a lot of different programs. There's if you're in the honors program, they do their own community service hours. I know if you're in any type of cultural organization, they do a lot of community service hours as well. Let me see. I might have to get back to you on that. It's been a few years since I remember doing community service. I would need to go back and look at what kind of organizations there were. But I mostly did it through the honors college and through whatever cultural organization. Like there's the Chaldean American Association, there's the Lebanese Association, there's a Muslim group association, Christian groups. They all do community service, and they do a lot of community service. And it's not just cultural or religious based. There's ecology. You just have to kind of, I believe Wayne State has a community service group website. I can probably find it for you guys and send it to you. That's where I did find some of the organizations I was in.
Okay. How many hours of PCE did you have?
I'm sorry, can you guys clarify PCE?
Patient care experience.
Okay, patient care experience. So I had a lot. I had, I think, close to 1,000, maybe a little more, because I did volunteering at Henry Ford in transport for 3 years. I did global brigades. That was, I think, maybe, I want to say close to 100 hours. Scribing, I worked as a scribe for 10 months. So between part-time and full-time each week, that got me a lot of hours. I think over 1,000 as well. And don't let those numbers scare you. They're really not that hard to get when you're doing it every week, and you're doing it, for months or maybe years. They're really easy to accumulate.
Wait, I have a question since we're talking about this. Did you need to get paid hours for patient care hour and ones with volunteering?
So when I talked to one of the pre-med advisors, she said it might be a good idea to look for the type of experiences that pay, because they're more closer to patient care. That's why I went and looked for a scribe job. One, because I'm in my gap year, I kind of maybe could use some money. It would be a good idea to get a job, and it should be something in healthcare. A paying job does count as patient care experience. So that's getting a job and getting patient care experience. That's a good idea to do as well. That's why you can do phlebotomy, you can do scribe, you can do MA, you can do EMS. All of that counts.
All right. How
Can I
manageable?
quickly ask another question?
Yeah.
Okay, so what do you do for scribing? I don't know if you mentioned it earlier.
So as scribe, you kind of you go in before the doctor goes in. You go in and you start asking like just the basic questions like, why are you here? But get a basic history of their symptoms, the onset of their symptoms, and you ask about their past medical history, any past surgical history, what medications they're on, what allergies, their family history, and then their social history, like do you smoke, drink, what's your sexual activity, do you use any drugs, and you kind of go, you type that up on a computer into their chart. The doctor reviews that with you, and then the doctor goes in following that. You also kind of type whatever the doctor is saying in the room. So you're basically scribing or writing whatever he's saying, recording the visit.
Okay, thank you.
No problem.
Thanks for the great questions. Just as a reminder, we ask that everyone keep their microphones muted and ask questions in chat. Next question, how manageable is scribing during the semester?
It depends. It depends on your schedule. If you have a light schedule during the semester, scribing is definitely doable. It can get a little bit busy. Most clinics are very busy. They have patients back to back. So maybe doing part-time is manageable than full-time if you're still in school. And maybe doing just weekends or certain days, you kind of have to make it work around your school schedule. You also have to think about how much you're studying, where you're volunteering. I didn't start scribing until my gap year. I just did not have time to find a job and work part-time during school because I was already doing research. I was studying for the MCAT. I had my courses, a little bit of volunteering here and there. So it depends on how big your load is for the semester.
How do you cope with burnout as a student?
That is a very, very good question. Because medical school, it's very difficult to have any time for yourself. You have to create your own schedule. The only way to get through medical school is to create a schedule that works for you for studying, and then having some time for yourself, for your mental health, for your emotional health, and your physical health. You need to at least set some time either after studying or taking one day over the weekend as a break for yourself. That's very, very, very important. What I do is I schedule some time where I'm not studying. I just relax. I can go see my family. I go either to the park or I see some friends and see a movie, or I'll just sit like on my couch and watch Netflix. So it's really, really important to cope with burnout because it's very common in medical school.
How is your scribing experience and how do you prepare to apply for scribing?
So I just I looked up some jobs online. There's if you go online, I think it's monsters.com. There's LinkedIn. There's another website where I just looked for scribe jobs and just applied to those. I uploaded my resume, looked at different locations, and it's like applying for a regular job online. That's how I found a scribing experience. You can also ask some friends. I know my friends gave me a few places that they knew where I could scribe. What I did is I found a job online looking up scribing jobs, and I got a few interviews. One was in Pontiac, one was in East Point. I ended up working in Pontiac, the Pontiac General Hospital. It was a pain medicine clinic. So that's where I scribed for 10 years. But it's pretty much You apply online, but to prepare for it, it's all practice. That's the best way to learn. I had no idea what I was doing or how to scribe. So someone was training me. They told me this is what the template looks like. This is how you access the EMR. And the first few times I did make mistakes, but that's how you learn. That's the best way to learn. Watching someone else do it, it's not the same as practicing yourself. So it's okay if you don't know anything about scribing. You learn while you're being trained, and get as much practice as you can.
All right, thanks to everyone for the great questions. Unfortunately, we had a case study planned and we want to make sure we get time for that. So I think we'll move on from the questions for now and we'll revisit them if we have time at the end.
Okay. Okay. I mean, even if you guys want, maybe you guys can send me questions like by email or a Google Doc. I don't mind. I can just answer them on there as well. So do I just share screen?
Yeah, you can share screen. You should be able to.
Okay. It says I'm not allowed to screen share.
Let me see if I can change something in the options here.
Okay.
Try now.
Okay. Okay. Okay, I have to just change my security settings real quick.
No problem.
Okay, let's try now. Okay. All right, do you guys see my screen?
Yep, it looks like it's visible to us.
Okay, let me just try and get it to be a slideshow. Okay, so this is the case that I have. So a 16-year-old female presents to your clinic with complaints of jaundice and abdominal distension for 4 days now. She also has increased episodes of epistaxis, which is nosebleeds. She had one sibling who died at the age of 6 following jaundice and abdominal distension. So is there anything that pops out to you guys? Any hints, anything that these symptoms make you think about, or like what systems are being affected right now? It's okay if you guys don't know. I can. Okay, liver failure. That's good. So the liver is being affected. Jaundice is usually a sign of either liver failure, inflammation of the liver, abdominal distension. All can be from a lot of things. It can be from malignancy. It can also be from the liver causing portal hypertension and ascites, which is just fluid accumulating into the abdomen. So good. Let me move on to the next. So this is the differential diagnosis. That's where you kind of come up with what you think could be going on. You need to come up with a list. So like a malignancy, it could be pancreatic or hepatic cancer, which is the liver. It could be infection with the pancreas or the liver. It could be autoimmune hepatitis, hemochromatosis, which is basically iron overload in your body. So iron is depositing in different organs. It could be the liver, the heart, the pancreas, and you would see symptoms being affected by from these organs being having iron accumulating. There's Wilson's disease, which is similar to hemochromatosis. Sometimes they get mixed up. Wilson's disease is copper overload. You get a lot of copper depositing in your organs, specifically the liver, the brain, your kidneys. And then it could be a drug reaction. So antibiotics are one example of where your liver is affected because your liver functions in drug metabolism. So if you're having a drug reaction, you can get liver inflammation. And then there's also acute fatty liver of pregnancy. So someone who's pregnant can also have changes in their liver that are fatty, and they would, have jaundice, abdominal distension as well. Okay, so you do a head-to-toe physical exam that reveals scleral icterus, which is yellowing of the eyes, and Kayser Fleischer rings, hepatosplenomegaly, and edema of the lower extremities. So the picture to the left, that's scleral icterus, that's yellowing of the eyes, the white part of the eyes. Kayser Fleischer rings. If you look at the images on the right, the 3 images, can anybody tell like what's wrong or what's abnormal with these eyes?
There's like a halo around the eye, I think.
Yeah, that's right. So you see this deposition around the periphery of the cornea, that little halo. It looks like a tan brown color. Those are Kayser Fleischer rings. They're pretty diagnostic. I'm not going to tell you what they are just yet, but you can see them in each one of these images. Let me see. And then hepatosplenomegaly, that just means enlargement of the liver and the spleen. That could be because of portal hypertension. So they get pretty big. So I guess I can tell you, they have, this patient has Wilson's disease, which is copper deposition in multiple organs in their body. So because of the Kayser Fleischer rings, that's pretty diagnostic for Wilson's disease. You won't really see that in any other diagnosis, and it is harmless. So it doesn't really affect your vision. So you have high suspicion. How would you diagnose this? You do a history and physical. You do serologic testing. So you look at their liver function test, and what the liver function test looks at are these 2 enzymes, the AST and the ALT. They may be normal or they may be elevated, so you don't just go off of the LFTs. You check the CBC if they're anemic or if they show thrombocytopenia, which means that they have low platelet levels. Platelets function in clotting, so, and they're also would be seen in the CBC. And then finally, you do copper and ceruloplasmin levels. So for Wilson's disease, you would have decreased levels of copper. Decreased levels of copper and ceruloplasmin in your serum, but increased copper urinary excretion. So that's what you would see on serologic testing. And then an ocular slit lamp exam, that's what this picture shows. It kind of looks at the cornea, just like how you saw the rings. That's basically what it's looking for. You do a 24-hour urinary copper excretion, which you would see increased copper. Genetic testing, because Wilson's disease is genetically inherited. It's an autosomal recessive disorder. So you would get the mutation from both parents. You can do liver biopsies and brain scans, although they're not really done that often. The stuff I mentioned before is pretty much enough to diagnose Wilson's disease. So this is what the liver would look like. The normal liver is on the left, a gross image of what the Wilson's disease looks like on the right. So you see these little nodules, that's all copper deposition in the liver. And then if you did a biopsy and looked at the histology, so the left is normal histology, normal liver cells. To the right, you see this staining here. They use I can't remember the name of the stain, but it stains for copper. And you can see all the deposition in each hepatocyte. And then if you did an MRI of the brain, so the left is a normal MRI of the brain. Here on the right, you can see deposition of copper. It's the white area near the ventricles and in the basal ganglia. That's just copper deposition in the brain. And you would have neurologic and psychiatric symptoms if you had copper deposition in your brain. It's just not very common in children. It's more common in adults and the elderly. So a little bit more about Wilson's disease. It's also called hepatolenticular degeneration. Hepato meaning liver, lenticular meaning convex, so like the eyes. It's an autosomal recessive disease The gene that's mutated is called ATP7B on chromosome 13. So this codes for an ATPase, and this protein, what it does is it transports copper to your bile, and it also puts copper in ceruloplasmin. Ceruloplasmin is the protein that kind of carries copper in the bloodstream. So if ATPase isn't functioning, you can't take copper to the bile, and you can't put copper in ceruloplasmin, so it deposits into your organs, and you can't excrete it. And then the majority of patients diagnosed are usually between 5 and 35, but it can occur as early as 18 months and as old as 70 years old. And the prevalence is 1 in 30,000 individuals. So some of the clinical manifestations. So someone with Wilson's disease, the presentation depends on which organ of the body is affected, and it varies by each patient. So if it's your liver, if it deposits in your liver, you could see abdominal pain, ascites, which is fluid buildup in your abdomen. So your abdomen doesn't enlarge as well. Jaundice, which is yellowing of the skin, hepatomegaly and splenomegaly, which again are liver and spleen enlargement. Coagulopathy, which means you have trouble with clotting your blood. So you might have increased bleeding, like nosebleeds, your gums bleeding, a longer time for like a cut to just clot and stop bleeding. You can have mental status changes due to hepatic encephalopathy. So remember, your liver helps with metabolism and getting rid of waste. If your liver is not functioning correctly, you have more waste in your bloodstream that can cross the blood-brain barrier and cause neurologic changes or psychiatric changes as well. So let's say you have copper depositing in your brain, you can have neurologic manifestations. So ataxia, or trouble walking normally, dysarthria, which is trouble writing, a tremor with your hand, Parkinson's symptoms, drooling, and these aren't just the only symptoms you might see, there are a lot more. Some psychiatric symptoms could also be personality changes, irritability, depression, impulsiveness. So overall, for pediatric cases, majority you would see hepatic or liver manifestations, while adolescents and older patients, you can see more neurologic symptoms, signs and symptoms. Now, how do we treat this? Treatment is lifelong because this is an autosomal recessive disease. There's no cure for it. So what treatment aims to do is remove or detoxify the tissue that has copper in it, and continued treatment to prevent reaccumulation. So one example is penicillamine. That's a chelating agent that binds copper and helps excrete it, but you would also need to supplement with vitamin B6 because it kind of prevents absorption and function of vitamin B6. Another option is trientine. This is second line. This is for people that want fewer side effects, or if they're allergic to penicillin and they can't take penicillamine, but it's also a chelating agent. And then patients are also given zinc. It helps prevent copper absorption from your diet. And these are my references. So do you guys have any questions?
We had one sent in the chat before. They asked, don't limbo rings look similar? This was asked, sorry, go ahead.
Oh, no, it's okay. A limbo ring, I actually have never heard of I guess they are similar. We haven't really learned that much about limbo rings. So I'm not sure, but looking it up right now, it does look similar to the Kayser rings, but they probably have a different pathophysiology. They do look similar, but they're not the same. You don't get it, the pathogenesis is not the same. But that's a good question. I would have to actually look that up. Any other questions?
If there are no more questions on the case study, I think we can revisit some of the ones that we missed earlier.
Okay, that's fine. I'm sorry. About the limbo rings, I'm so sorry. I misunderstood the question. Yeah, that's a normal finding. That's actually, I had that problem. I used to confuse the Kayser rings for limbal rings as well. That's why they use the slit lamp to look at the cornea. It's very easy to mistake. It's very easy to mistake, especially early in Wilson's disease. But later on, as the disease progresses, it becomes more noticeable.
Okay.
Sorry, did I interrupt somebody?
Oh, I wanted to ask, like, how would you tell the difference between them then?
So what I read about Wilson's disease and the Kaiser rings is that they're kind of hard to spot early on. Even though you have a little bit of a Kaiser ring, it's hard to spot. So as the disease progresses and you use the slit lamp, you can sort of see this tan discoloration that starts to get wider. It's a slightly different color from a limbal ring. Limbal rings are darker than the Kaiser rings because copper creates this tannish brown color. But it does get missed a lot early on in the disease. So that's a good question.
It looks like we don't have any more questions about the case study. Someone asked earlier during our initial Q&A session, why did you want to attend Wayne State's med school?
So I grew up in Michigan. Obviously Wayne State has a cheaper tuition. That was one of the reasons. I also enjoyed my undergrad experience at Wayne State. So I kind of wanted to stay within the same community as Detroit. It's kind of a community that I want to serve in the future. I would like to serve in a rural or urban type of community. I also wanted to kind of stay close to family and friends as well. But I do live Midtown, so sometimes I'll go maybe every weekend or every other weekend to visit family. But it's just mostly because I grew up here. I wanted to kind of stay in the same area.
Could you go a little more into detail into what you specifically do during rotations?
Okay, so rotations, you get to do a lot during rotations. During surgery, it depends on the rotation, but during surgery, I was able to scrub in, meaning I had to do the full scrub. I had to put on the full uniform, the PPE, and I stood there and watched the surgeons and the residents perform the surgery. Sometimes they let you do some stuff like maybe like hold open the incision, or they do try to get you to do suturing as well during closing. They like to ask questions. You do a lot of rounding, so you will go see the patients that are inpatient in the hospital, see how they're doing, do a full interview. Each interview for each rotation is different, so you're gonna have to learn how to do an interview and what questions to ask. Like OB-GYN, I had clinic today. So we had a lot of patients that were pregnant, so they were here for prenatal care, to do ultrasounds, to some patients, if they had an STD or an STI, we would do testing. We did pelvic exams and pap smears. It's basically helping with the regular visit. I was able to go in, I do the interview, I do part of the physical exam, and then I come out, I present to the physician, and then we both go in and do more testing. So you get to do a lot of practice. They give you a lot of freedom, and it starts to feel real. You start to feel like you're becoming a doctor.
Do you have any advice on writing a personal statement?
Okay, so I know that's one of the hardest parts of applying to medical school, because your personal statement, it's hard to talk about yourself. So it doesn't even have to be the most exciting thing to happen in your life. It could be something very simple. It's just how you explain it, how you tie it to medicine. That's what they look for. They're not looking for some crazy thing you did, because we all have boring lives. I have a boring life. I didn't do anything fun. but I talked about what got me into medicine, my journey through being a pre-med student, and basically just be honest, just don't embellish the story. I know a lot of people say you gotta make it sound so amazing. It's just, nobody has a crazy story. It's all about why medicine, what got you into medicine. They just want to know you a little bit deeper.
Can you talk about the medical school curriculum at Wayne State? What do you like and dislike about it?
So for Wayne State's medical school, they're doing the new curriculum. I know they made changes for the second year, for the second class. So in my class, they switched to organ systems. We started off with the foundations unit. Then we moved on to musculoskeletal and skin. And then we had cardiopulm. So we just kept moving on between organs. And at the end of each unit, our exam was an NBME exam, which is like a retired board exam, basically. And the professors get to pick which questions to put into the exam. Some other courses they put in while we were in those units, we learned how to do ultrasounds. We did an emergency medicine course where we learned how to do CPR, use defibrillators. What else? Oh, you do have a lot of small group sessions. Every student gets placed in a group that's maybe 5 to 6 students, and you guys are going to be with that group for the first 2 years. You guys are going to be like a family. You do your anatomy group, so you do anatomy with that group. You do all of your immunology and microbiology sessions with that group. You do a lot of, any small group session is with that group. So you become best friends. You become like a family. You rely on each other. Which is a really good thing because it's such a big class. It's hard to, get to know everybody. So it's nice having that small group throughout the first 2 years of medical school. Some changes they made between my class and the next class, they started adding in more professor written exams. So there's not just the NBMA exam you take at the end, there's also a professor written exam for things like histology and anatomy. So that was added to the next class. I don't know if it was continued for the third class, but I think it is. I did like the NBME exams because they do prepare you for step 1. It's like a practice every unit, which is very, very helpful. And what did I dislike? I don't really think I disliked anything. It takes a while to get to learn what resources you need to use. Some people use the professor notes. Some people did never touch them. They used BRS. They used other outside sources. So that took a while to figure out what I liked and what I disliked regarding studying. And I know they don't require you to go to lecture anymore.
Do you have any tips on how to ask a medical professional for a recommendation letter?
So for every medical professional I asked, I either did some kind of shadowing or internship, and at the end kind of asked them, would you be willing to write a medical or a recommendation letter for me? You want to get it from someone who knows you really well. Because the more they know you, the more personal it becomes, and the better the letter is. I know I asked one of the medical professionals, I actually emailed first and asked, can I do an internship with you for maybe 2 weeks and then talk about a recommendation letter? And he was very open to it. For my professors, I just asked them in person, would you be willing to write a recommendation letter for me? And that worked out well too. You just gotta find somebody who knows you really well. I had more professors than medical professionals write a letter for me because my professors I was close to, they knew me really well. So they wrote me excellent recommendation letters, and those helped a lot. They don't have to be medical professionals. I even got one of the Detroit teachers that I was working with when I was volunteering with teaching to write a recommendation letter for me.
Okay, we have a couple more questions here. Just a quick note, the Google form for attendance has been posted in the chat, so please, everybody make sure you have that link. The next question, what are some pros and cons of majoring in a hard science in undergrad? And would you say the major matters when you're applying to med schools?
I don't think the major matters, honestly. My best friend majored in Spanish and he got into medical school. But he also minored in like, I think it was chemistry. Um, honestly, as long as you do well, you don't have to major in a hard science. I chose biology just because I love biology and it's a subject that interests me. My sister did nursing for her she got her BSN, she got into med school. My other sister's doing physics. I have a best friend that had an art major and she got into medical school. It does not matter. Do something you enjoy, something you will do well. They want to make sure you can handle or you do academically well. That's what's important. But you do have requirements as well. And that's kind of nice. What's nice about doing a biology major is you hit all of those pre-med requirements. So that's why you see a lot of people doing a biology major. It hits on the majority of the requirements for medical school. But I say do what you like. You can still get the requirements done, even if you don't do a biology or chemistry major. That's okay. Mm. Are there any other questions?
When you reapplied to medical schools, did you rewrite your personal statement?
So when I reapplied, I modified it. I didn't completely rewrite it. Because I was told I talked to multiple advisors and some of the interviewers, what they thought of my personal statement. They said it was great. So I modified it to include some of the changes I made and talk about, changes I made during my gap year. It's a good thing to include in your personal statement, but if it's a really good personal statement, you don't want to rewrite it. I didn't completely rewrite it. I just maybe tweaked a few things, took out some information to put in new information. But if you need to kind of get more people to look at it, see what they think, see if it's a good personal statement or not.
When do you recommend we start asking for letters of recommendation?
See, you can ask maybe 2 years before, 3 years before, a year before. It just depends. Give your professors some time to write the letter. Like I remember I had a rec letter written 2 years before applying, and I had a rec letter written a few months before applying. It just depends because each month, throughout time, you're gonna be meeting new people. They might like you a lot. You might not know them really well. They might write a really good letter. But just give them some time to write the letter. You don't want to overwhelm them. You don't want to rush them. You want a good letter. So giving them a couple months, maybe a year is a good idea because they are very busy. But honestly, there's no specific time to ask for a letter. Just if you finish, let's say, a course with a professor you know really well and they know you really well, and that then at the end of the course, you would ask, can you write a recommendation letter for me? I know Wayne State their pre-med counselors will hold those letters for you in a folder. So you can ask anytime. It'll be saved for you and ready for you.
Okay, and the last question I see here. So your sister went to nursing school and then med school as well?
Yes, so she started off wanting to be a nurse. So she did the accelerated BSN program in Oakland. Later on, she decided that she wanted to be a physician. So while she was doing her BSN program, she took a few courses to get the pre-med requirements. And then after she got her BSN, she had, I think, 1 or 2 semesters where she was completing the rest of her pre-medical requirements, and then she applied to medical school. So she was also working as a nurse and then until she got into medical school. Should we provide a template or something similar for individuals? We ask letters of recs if they are, for example, an employer. So what I did, because one of my rec letters was from a Detroit teacher. He said he's never really written a rec letter. So he kind of asked for examples. You can provide a template. That's totally okay. That's fine. He did ask for a little bit of help. I showed him some examples, some things. I basically told him, like, whatever you think, just, this is a little hard to explain. Whatever you think about me, write in that letter. But what I had to do, I just showed him some examples. And I had the counselor read the rec letter. They don't let you read it, but they will read it. And she told me it was a nice, intimate, honest letter about me as an individual and as a volunteer for his class. If that answers your question, I hope it does.
Okay, if there's no more questions, I think we can wrap up now. Thanks so much for this great session. We had a great time and we got some really great insight. To our Wayne State University students, make sure that you guys fill out the form that was posted in the chat here. And if you have any trouble accessing that, let us know so we can make sure we get your attendance down. I hope everyone has a great night. Thanks for coming and talking with us, Amanda.
No problem. Anytime.